The studies we've looked at in the United Kingdom have shown that an increasing number of young people are starting to vape. Now, vaping is 95% less harmful than smoking. That's the first thing to note. And it's a good product that people can use if they're already a smoker. As an adult, if you're wanting to quit smoking, we know you're 7 times more likely to quit smoking if you have support and use an aid such as an e-cigarette. But although they're 95% harm-free, that doesn't mean they're harmless. And we're seeing a cohort of young people who are taking up vaping, and we don't know the medium to long-term health effects of this. We do know there are some short-term health effects, and for some people they've developed pneumonias, for example, and had difficulty in breathing. And it's for this reason we want to try and understand more how big an issue it is for us here in Gibraltar with our young people.
Has the hospital seen any cases of these harmful side effects in children locally?
So in Gibraltar, no, not that I'm aware of as yet, but round the globe, yes, we have seen people presenting to hospitals, and in fact we have what's called the International Classification of Diseases, which is our coding disease classification book, and they've actually introduced a new criteria in that book for classifying vaping related injuries. Normally they're lung based, but I must say all the evidence indicates at the moment they are quite rare, but that's in the short term. We don't know the medium to long-term health consequences.
Would public health like to see more regulation around the sale and marketing of these?
So legislation and marketing is absolutely one aspect of things, and we've learnt that over the years in terms of cigarette smoking and the progress that has been made around not glamorising the products. Absolutely, we would like to see more regulation around vaping, but also we want to explore what would help people stop vaping. These are addictive products. This is nicotine, it's an addictive substance, this is an addiction that young people are being exposed to. So what we want to do is set up a research collaboration to look at what interventions may work and may support people who want to quit vaping to be able to quit.
Is there any idea of what these might be?
Not yet. We're reviewing the literature. We're having conversations with colleagues at the University of Gibraltar to look at could we set up an intervention research trial here to look and support people in terms of that intervention.
And you've set up a survey for school children. Can you tell us a bit more about the methodology of this, how it will be rolled out, and what sort of questions, what sort of information you're looking for?
Absolutely. We are really interested to learn more about how many young people vape. We don't know that at the moment. There's a perception that many young people vape. In the UK, they estimate it's only actually about 10%. Well, 10% is concerning, but it's not everybody. So we're going to do a very short survey that it can be accessed through a QR code or an online link, and it'll only take a couple of minutes to fill in, literally a couple of minutes. It's totally confidential and just starts giving us an indication and feel for how many young people are vaping.